I am so excited to be here with each of you. We have a full schedule, and as you heard from a number of people, Pauline and I feel very grateful because people do repeat these classes because they find, oh, there's a lot here, let me come back around. But also it's about that sense of community, and we love bringing all of you together, and we love connecting and meeting new people and welcoming you into our tribe here in Florida as well. So, while there's a lot to cover, it's going to be a fun weekend. I've got a lot of new techniques that I think you're going to find. A number of them are going to be for self-care. So for some of you, it's going to be right up your alley. Some of them are going to be really more practitioner-oriented, and we're going to do table work. So let's take a look. You have the schedule in your packet. I'm not going to go through all that, but tonight we're going to start with unraveling the mystery of the immune system. And that's kind of a big, tall order, unraveling. So there's the schedule right there. Unraveling the mystery of the immune system. We're also going to look at the immune system from an energetic perspective, because that's what we do, everything we do. And as I mentioned a minute ago, I first start off with taking a peek at what's inside your toolbox. And then we are adding on top of that. Tonight we are also going to do some protocols. We're going to do an aura cleanse, which is a lovely experience. It's the one that we're going to use the selenite wands for. And we're going to do an aura bath, which is what we're going to use the silk scarves for. And if you've experienced that before, then you know that is a real relaxing treat. So that's why I like to do it in the evening on Friday night, because it just relaxes and sends you off to bed. And then T-taps being thymus taps. And T-taps are something I use for a lot of immune protocols. It's a gateway. If you've taken any of my previous energy mastery workshops, or you've happen to have viewed any of them online, you'll know that I like to find an entry point with something. So whether it's the thymus or the heart electric or the power point or something, I like to find an entry point, and then I look at how are all the ways that we can connect in and utilize that entry point. So you'll see that theme as we go through all the classes. So this quote is in your handout. And it's a quote by Dr. Candace Pert, the author of Molecules of Emotion. And I feel really grateful and blessed to have met her and to have heard her present a couple of times before she passed. Donna and David did have her at an iGym in San Diego a number of years ago. And what a brilliant woman. And so much of what we're going to be talking about with immune, if you've ever studied with or read any of Dr. Candace Pert's work or Dr. Bruce Lipton's work, you know, Biology of Belief is one of his books. It's all about cellular function, DNA, epigenetics, and how, you know, whatever happens at birth, you know, whatever happened to our parents, yes, we get their DNA and we come in with that. But some of the things, it's a matter of us making a conscious decision, honestly, of are we going to switch that on and are we going to activate that? Or are we going to make choices, lifestyle choices, that are going to switch that on or activate that? Or are we going to make choices such as doing energy medicine on a daily basis that say, you know what, I don't have to flip on the diabetes switch. I don't have to flip on the cardiac switch. You know, I really can make a conscious effort and work my energies. So all of those people, there's some others as well, Joe Dispenza, Rupert Sheldrake. I mean, all their work is really foundational for everything that we do and study. So if you haven't spent time with them or followed them, there's a lot of things on YouTube and a lot of books. Great place to start. So here's some wise words. The bones are giving rise to the brain. Think about that for a minute. The bones are giving rise to the brain. Can you even picture how that works? Ancient Chinese medicine says that qi, loosely translated as your life force, your energetic life force, it originates in the bone. Now we are showing in the Western model that cells start as baby stem cells born in the bone marrow. So that's the connection. The bone marrow, the brain itself is marrow. So the long bones are where the bone marrow is generated, and so that's the Oriental Association of Brains, bones to brain. So the model that cells start as baby stem cells born in the bone marrow, becoming immune-like cells as they pass through the body, and then arrive in the brain as brain cells. So see, these cells are evolving and changing as we even take our first breath and come into this life. This migration, our lab has shown in the 1980s, was directed by molecules of emotion in a process known as chemotaxis. So one of the things we're going to learn tonight is some of the processes of those pathways. And as you might imagine, there are points on the body from an Oriental medicine perspective that allow us to speak directly to the marrow, right? And if we talk to the marrow, who can tell me if we talk to a point that connects to the marrow, what will we affect? Who will we impact? Any idea? The brain. Thanks, Diana. And what else? Bones, immune system, white blood cells. Lots of things are made in the marrow. Does anyone, before we get into it, does anyone know what it's one of the 8 influential points from Oriental medicine. Donna Eden just taught it earlier this year in her frequencies class. She taught the influential points again. Anyone happen to know what the influential point is for bone marrow? It's a gallbladder point. Gallbladder 39. Good job, Sharon. Gallbladder 39. So it's that simple that we can literally go down to gallbladder 39 and start manipulating that, holding it, massaging it, tapping it, what have you. And we're talking to the marrow. We're talking to the immune system. We're talking to the white blood cells. And we're talking to the brain. Is that incredible? It's that, the gateways are there. It's literally can be that easy. So let's take a look. So this is a normal immune system on the left. Regulatory T cells, rich and balanced bacterial communities. So you're going to find out that the term microbiome is, we think of it just about our gut. It's really come around the last 2 or 3 years. You've probably heard a lot of telesummits about microbiome and the word as a buzzword, the microbiome. But it's not just about our gut. We have a microbiome that's around our entire body. It's on our hands, it's on our skin, it's everywhere. So this is a rich and balanced bacterial community. We need healthy microbes. People think that, I need to get rid of all the bacteria. I need to get rid of all the viruses. I need to get rid of all the candida, the fungal, what have you. No, we need a healthy microbiome. So it's a matter of how do we take the healthy ones and engage them and encourage them to flourish and thrive, and then how do we stave off the ones that are invaders and are not healthy, that can create infection and disease and problems for us. So those are some of the things that we're going to unravel the mystery of and see how we can make a difference. So on the right, you can see there's an immune disorder or some type of pathology, autoimmune disorder, allergies, a metabolic disorder. There's some kind of immune disorder going on, and as it's circulating through and around, there's poor and unbalanced bacterial communities. Now, one of the things you're going to learn in this class is I'm going to teach you what I've been using for several years to access as a gateway to talk to the microbiome and find out what is the balance here. What's the healthy markers? Who is out of balance? When people come in and they're not feeling well and they're like, well, I'm not sure if I have a flu or if it's something to do with another issue that they have. So I need to have a way to find out, is it the bacterial community that's out of balance? Is it viral that's really high? Maybe it's mold. Maybe it's candida. So I'm going to share with you my non-scientific but my very energetic way to find that out and communicate. And we'll find out in the whole class how everybody's doing. So a normal immune system, as it cycles through, regulatory T cells, when you tap the thymus does what? thymus makes T cells. And we're going to learn what those are and why they're important. So one of the easiest things you can do for your immune system is all throughout the day is to tap the thymus. It's that simple, literally. I call it an energetic jolt of vitamin C because that's, to me, what happens. It's just like if you took a bunch of vitamin C to boost your immune system. And then IgA, you're going to learn in this class, if you don't already know, about immunoglobulins and why those are important, because they're going to help support whether it's healthy bacteria or viral or what have you. So if someone has a compromised immune system, they probably have one of the gamma globulins are low. So if I have someone I work with that has neutropenia, so they have a very low white blood cell count. And I have her on a formulation that's IgG because I need her immune system that can't do it on its own to better stabilize and create more gamma globulins. So you're going to get a better idea about what each of those do. And here are some microbes right here, right? That's a virus. I think they look neat. So we're going to have a few pictures here. Now this picture, what do you think this picture's of? It's a little tricky. What do you think it is? This picture is to show the vagina. And it is to show the vaginal, the gateway of the birthing canal, basically. So this, you see the little head of the baby, and you see, here's some good bacteria and probiotics. And so this is a photo that, an image that I found, and I want to share with you. This is in your handout. We come into this world, and our immune system is not formulated. You know, when you've studied Eden Energy Medicine, Donna talks about that and how it takes a while before it's formulated. But we do come in with immune system from passive immunity. And that is about how healthy was the mother, how healthy was our mother at the time of birth. That was about, was it a regular natural childbirth or was it a C-section? Big differences that start to take place with just that one change. How healthy was the mother at the time of the birth and during the pregnancy, in the sense that had she been exposed to vaccinations? Had she been exposed to toxic metals? I have I started to say young girl, but she's in her middle 20s now, and her entire life she has dealt with a significant grand mal seizures. In the early days, it was on a daily basis. Now it's less frequent, and we've been working to get it even less frequent. But one will never know exactly for sure, but the mother had high mercury and some other heavy metals at the time of the birth. And this child has had, delayed development cognitively and all sorts of things because of this is what happened in the placenta. So when women are pregnant, and, I have the great fortune of it's a really special experience to be able to work with women who are wanting to get pregnant or during their pregnancy. And during that time, it's important to look at lots of factors. Their diet, lifestyle adjustments, but also dental work. I mean, there's so many factors that can create a layer of what's going to happen with that child's immune function. So in the handout, if you look at passive immunity happens while in the womb. The mother transfers a bacterial community, and that's what's called the microbiome. And it mimics her oral and her gut health. And so the scenario I just shared with you, the mother had had a lot of dental work. So the microbiome begins in the mouth. So it's another big thing to think about as we're, even making our own choices for ourselves, is how good is our oral care? How good is our gums, our teeth, all of that? Let's see. IgG antibodies are transported from mother to baby directly across the placenta at birth. The newborn will have a high level of antibodies with the same range of antigens as their mother. So antibodies are the ones that help us to fight off, okay? So the more of the antibodies that we have, the stronger the immune system is going to be. It then expands to the amniotic sac, which breaks during labor and expands even further when the newborn is coated with healthy lactobacillus and Prevotella bacteria. So that's the importance of having a natural childbirth. That baby literally jumps through the birth canal, and as that's happening, it is being coated with probiotics, natural probiotics. Did everybody know that? So when I was born cesarean, you know, when you're born from a C-section, you miss that whole part. Now, fortunately, I feel like I ended up with a pretty healthy immune system, but a lot of people may start off with a little bit more compromise because of just that one piece. The next thing that happens is when the baby is touching skin to skin while on the mother's chest. You know, after childbirth, one of the first things they do is lay the baby and touch the skin. Well, a whole bunch of things happen with that. It's another connection with the microbiome of the mother on the skin, but also what hormone gets released when you're touching skin to skin or when you have a little baby laying over your heart? Oxytocin, the feel-good, love, cuddle hormone, right? So already we're infusing that newborn with the oxytocin. Pretty amazing, right? Haven't even left the hospital yet or the birthing ward. So the next thing that happens, so several layers of passive protection are provided by the mother, including the breast milk. So here's another piece. How many of you know that you were breastfed? Most of you don't even know. I know that I wasn't for very long. It didn't work well. And I also had a real intolerance to milk in general, and I haven't drank it as an adult. I don't like it. So that was a tricky piece. That was a piece where when the baby drinks the mother's breast milk, then you're getting colostrum. And colostrum is loaded with healthy immune function. So when the baby misses that piece or is quickly put on a formula or, heaven forbid, soy, which is not a good formulation for most babies or for anyone, we're missing that, again, another chance of helping to dose or amplify our immune function. So far, as a baby, I'm striking out here. I didn't, I missed quite a few steps. So let's see. Colostrum contains antibodies that are transferred to the gut of the infant and protect against bacterial infections until the baby can synthesize its own antibodies. This is called passive memory or immunity, since the fetus does not actually make any memory cells or antibodies of its own. Instead, they are borrowed from the immune health of the mother. Passive immunity is usually short-term. It can be a few months. But honestly, if we didn't get all of those steps, a lot of babies, the passive immunity is going to take much longer, right? Let's see, what else I want to tell you about this. I mentioned health of the mother during pregnancy, chemical substances, toxins. Let's see, vaccinations. That's another big, I could teach a whole class on vaccines. This is an immune class. We're going to talk about it briefly, but it is not a vaccine class. It has become quite the topic in the last few years with what's going on with the CDC and all of the fillers and chemical substances in the vaccines. And just while it's on my mind and triggered here, I can tell you that I had a patient, a young girl. Her mother was a patient of mine, and this was her granddaughter. Her daughter said that she knew the day she brought her daughter home from having her first vaccinations, the child was sick, high fever. She acted different than she had ever acted before. She was screaming and crying, and that went on for 2 days, and the child was never the same after that. She ended up having grand mal seizures her entire life, multiple ones on a daily basis. She ended up being autistic and really couldn't speak or communicate. And she lived until she was 13. I had the great pleasure of knowing Megan. And, it's interesting that the mother knew exactly when that happened, She knew, and there wasn't anything that could be done to reverse that. So it's potent and powerful stuff. And it's decisions that, as parents, they have to be made. As adults, I taught a class earlier this year at the Sophia Institute in Charleston, and one of the participants came up and was complaining about pain in her arm. And so I did a few pain techniques. I was pain siphoning and chakra clearing and what have you. And so I started inquiring. Inquiring minds want to know, right? How long had she had it? When did it first start? What had happened? Well, you know what? It started the day she got a flu shot. The day she got a flu shot, the vaccine stuck in the muscle. It didn't disperse and it didn't get absorbed. So she had been walking around with this pain for a few weeks. And I was able with pain techniques to actually disperse that. And then I recommended that she do a lot of neurolymphatics and a lot of detoxing, because now her body was going to have a jolt of that, right? So there are things, if you're in a situation that you have to get vaccinations, that we can do. If you go to certain countries, you're not going to be able to avoid it. If you have a child in school, it's hard to avoid that. So vaccines are a whole big hot topic. I want to share one more scenario with vaccinations. I had a patient who I met her many years ago when Donna Eden was here doing a workshop. And she came up and talked to me because her husband had Alzheimer's, and it was accelerated, and he'd had it for many years, and he was now really having difficulty doing a lot of those regular daily kinds of things for himself. And he was in a wheelchair. So I said, you really can't go wrong just doing the pieces of the daily energy routine. Big thing is get your energies crossing over for him. And he wasn't able to do these exercises himself, but she went home and every day for a year, she did these exercises on him. From the daily routine, she traced meridians, she did figure eight, she did everything she knew from that little class what to do. And slowly, after a few weeks, he started getting better just from that. He started, she started recognizing shifts. And one Sunday morning, all of a sudden, he got up, he walked across the room, he picked up the newspaper, started reading the newspaper out loud, and he hadn't done that in years. And he was better, and he got better, and he was better for, I think it was about 2 years. And then he got a flu, which became more like, where he got a respiratory issue, and they weren't sure if it was going to be pneumonia for him or a flu or what have you. She took him to the doctor. They gave him a flu shot. Guess what happened? In less than 24 hours, the man was dead. So here was someone who had completely was recovering from Alzheimer's, and because his immune system was so compromised, it couldn't handle what was in the shot. Does that make sense? So I want to share those now because I don't want to take all of that lightly as a topic. We may touch on it again over the weekend. I can talk to anybody in private, but it's a topic really all of its own. Yes, it goes with immune. Yes, it absolutely can make a difference of what's happening with your immune function, but it needs a lot of time to delve more into that. So we're back to the baby. So here's another, I think this is a cool picture. This is at birth. The baby gut community resembles the delivery method. This baby's gut microbiome looks like a vaginal delivery. Now, I'm not sure what a cesarean might look like. If it was a horizontal cesarean, maybe they're all colonized across, or a vertical one, maybe they're all colonized on central meridian. I don't know. I'd love to know. I've never seen an image that correlates. But isn't that amazing? That's the intelligence in the gut. And babies are bacteria magnets. So, a new baby crawls on the floor, picks everything up, it puts everything in its mouth, right? And that can be anything. They can be outside in the dirt, crawling around. It can be, things on the floor. It can be things that they pick up in the store or wherever they're at. And the great thing about that is they are colonizing and boosting their immune system. Everything we ingest the body has to create antibodies. So if we pick up dirt, it's like, oh, dirt, let me catalog that and categorize that and let me make some antibodies for that so I know, is it friend or foe, right? So if it's, whatever, on the floor, everything gets cataloged. Same way with foods. Every time you ingest some food as a baby, it all gets cataloged. Well, what happens is some babies, the mother maybe is very protective, or the father, and, no dirt, don't play in the dirt, don't play in the sandbox, keep the clothes clean, right? No crawling on the floor. Have you seen kids that are one versus the other? Yeah, so the interesting thing is how healthy is the immune system of the child that didn't get to inoculate itself in the first, 12, 14 months or whatever, especially as they're still crawling, right? And it's important for the crawling because what gets established energetically and neurologically with the crawling? The cross crawl is the crossover of the right brain to the left side of the body. So when a parent is encouraging a child to walk early and to skip the crawling, then that's not really helping neurologically either. So bottom line is, get the kid outside, let him play in the dirt, let him get dirty, and let him crawl all over the place, right? This is probably the piece that really made the difference for me because I didn't check those boxes in the natural childbirth because I grew up on a farm. And I was outside, and, you're playing in the mud or the dirt or digging a hole or you're around animals. And so I think I had a lot of natural inoculation, and that's probably a big shift and difference for my immune system. Influence of external factors on intestinal microbiota of infants. So this is really detailed in the sense of all the probiotic types of strains. And I just put this up here because it's kind of interesting. Breastfeeding is high in bifidobacterium versus formula feeding is enterobacteria. Which is a bad bacteria. So the green bacteria are the good, healthy ones. The red ones aren't so healthy. So you can see with the C-section versus vaginal, 3 good probiotics there. The C-section, staphylococcus, staph infection, right? Corneobacterium, propionobacterium. So those aren't good, healthy kinds of bacteria that we want. And then you can see that familial environment, there could be exposure to Clostridium, contaminations, translocation is contaminating from one to the other. So you can see from here's prenatal, what's happening, genetics, epigenetics, and contamination from the mother. And then you can see birth to first weeks, first months, adult-like microbiota. You can see what starts happening. And do you know that most people right now on the planet have some kind of gut health issue? In fact, when people come to me, it kind of almost doesn't matter what the issue is they're trying to focus on. I was going to say 9 times out of 10, but maybe I'll say 7.5 to 8 times out of 10. The place we end up starting is the gut. And they're like, but Dr. Melanie, I came in because of this. And I'm like, yes. And if we just go there, all these other things are going to keep happening versus if we go and look at what needs to happen to solidify and fortify your gut, then we're going to make progress with this over here. Does it make sense? So effective maternal exposures, I've talked about some of these: environment, antisepsis, antibiotics, diet, other host, epigenetics, oral, pre-mastication of food, but also dental, breastfeeding, cutaneous skin, and then vaginal. So there's a lot of ways there that the mother is really supporting the baby. I think I've talked about everything on that slide. So then we have innate adaptive white blood cells. So we go from this passive immunity to a time when, as a baby, that we're now, our immune system is starting to take hold and it's starting to evolve on its own. It's saying, okay, I got some good support here from my mother, but now I've got to kick things on for myself. So this is just showing all the different parts in a white blood cell. And T cell right here, When you thump your thymus, that's what you're making, T cells. You have natural killer cells. So these natural killer cells are ones that are going to go in and look for the bad bacterias or the virus or the bad things. We're trying to go in and flush those out. We also have neutrophils. So in your handout, there's a lot of information in detail about these, and I know most of you aren't in a situation where you're probably working with nutritional supplements with your clients or probably even reading blood lab reports. Is that true? Maybe a very few of you. The reason why I share this with all of you is because starting to get an idea on the terminology and the function of the immune system, when they come in, they might have lab reports that they've already looked at, and they know that the issue is their white blood count is low, or their vitamin D level is low, or this is high, or what have you. And so the more you can understand some of the terminology and have resources to go back and say, oh, this is how this correlates. Here's what I can do energetically to support this. My providing you with all of these kinds of details isn't to make you or encouraging you to be a functional medicine doctor. Or encouraging you to do something that you're not licensed to or educated to. It's just to give you another level of awareness to say, how does this work with the energy? What do I need to do to really support that? So there's a lot of other things on here. Neutrophils consume bacteria through phagocytosis. Phagocytosis is like the little Pac-Man, right? He goes in, here's bacteria over here. He's like, oh, yes, and he gobbles it all up. So we want that to happen for the bad microbes, but we want to also support the healthy ones. Lymphocytes. What do you know about lymphocytes? Even without, what could you assume with lymphocytes? It's about lymph, right? Yeah, moving toxins out, working with the blood. It's the second most common leukocytes. They move mostly through the lymphatic tissues. What do you already know how to do that talks to lymphatic tissues? Neurolymphatic reflexes. There's one for every organ and every meridian on the body, right? Here's the lung ones. Liver is a common one that I'm using all day long, really. Liver, stomach's over here, spleen, right? So we have gateways already that says if someone's got something going on with lymphatics or with leukocytes, there's something we could do to support that. B cells produce antibodies. So we need B cells because we need antibodies to be created to help support the balance so that we're not just looking at everything we ingest, everything we touch, everything we come in contact with. We don't want it to all be seen as some kind of foreign invader, right? Because a lot of things are healthy for us. T cells target viruses, fungi, cancer cells, and transplanted cells. Again, if you don't know anything else to do for your immune function than this could very well be enough if you did it a lot, right? That's simple. Let's see, eosinophils, they destroy parasites and also combat the effects of a histamine reaction. Anybody know what a histamine reaction is about? Yep, Gail? Yes. Yeah, so Gail has described it beautifully. It's about when we take something into our body and the body perceives it as an invader and it begins to react. And so that could be for someone, that could be shellfish. It could be gluten, right? It could be something in the soap you just used. It could be any kind of food. It could be a vaccine. It could be anything. So when I'm bringing something in and my body is saying, I don't know what that is, and I'm now having to make antibodies for that, and it's an invader, there's a histamine response. It means there's an inflammation that takes place, and it's trying to fight it and ward it off. And sometimes it's because that happens maybe over time. Some things that might be good for the person, now the body is just reacting and responding to everything. And I have a number of clients that I work with that have come to me because they have, how should I say this, multiple chronic health issues, including significant gut issues. And when that's the case, the body is a reactive factory. And we have to, back up and start sorting out. You can't just bring 20 new things in for the body to make histamines and respond to. You have to start rebuilding, repairing the gut, fortifying the immune, calming the inflammation down, and then getting it so that things aren't going to keep reacting. So gluten, if someone has a gluten intolerance, gluten sensitivity, histamines get made. Alcohol, histamines are created. So it's about what's happening, what are we ingesting or what are we coming in contact with? And I use the word what are we coming in contact with. It doesn't have to be about ingesting. We are in a world filling now more and more so with electromagnetic frequencies. So that's another big piece, and we're going to talk more about that too. All right, so you guys get the gist? There's a lot happening in white blood cells, right? I have a patient that I worked with off and on for a while, and I didn't see her, and then she came to me and said, Dr. Melanie, she had neutropenia. So her white blood cells were low, and she really needed more nutrients in her body. Well, it ended up that it was way more than that. There was uterine cancer, and she chose to go the Western track, and she did radiation, she did chemo. Well, what do you think if you have low white blood cell count and you have neutropenia and you bring chemo in? It's going to be challenging for the immune system to be strong enough after all that has happened that the blood cells can respond. And so I knew she was doing that track. I helped her with some supplements and things, but then I didn't see her. And actually, I didn't realize I hadn't seen her. It had been a year since I had seen her. And she called, and she came in, and she said, I really need to see you. She said, I did all of this. I seem to be better. I now am having these symptoms. I've gone to the oncologist. Her white blood cell count, I think, is at 3. It's so low. I don't even know how she's functioning, right? And they can't find anything else wrong with her, nor can they offer anything else to support her. So we are working diligently with energy medicine and with nutritional supplementation. And I, in the first session, adjusted the supplements she was taking. Maybe dosing was off, or maybe it wasn't the right one. I got her back on all the immune supporting things that I had her on like a year and a half before or whatever. She came to see me 10 days later, and do you know she was exponentially better just with that. And I've now seen her 2 more times, and she's like, I've got my life back. I'm not going back there. I'm not even getting insurance this year. She said, I am going completely, totally alternative, and she's made adjustment in her lifestyle, adjusted back her work hours, doing more fun things, focusing on her diet. That's what we do all day long, is look at all the pieces, because they are impacting our immune system. And from that is why we end up with all sorts of health issues. So white blood cells are critical. Phagocytosis, I mentioned, it's engulfing a microbe. So here's something, it's seen as foreign, it doesn't matter what it is, but you see how it actually puts like a gel around it. It actually is engulfing it in a viscous material. I think all those are fascinating. I could just spend all day talking about those. Immune system. I want to quickly go through what is our immune system. Who knows what makes up our immune system? Tell me something that's part of your immune system. It's not too hard. Anybody? Lymph nodes, yes. And the lymph nodes are connected to what? The lymph vessels. So we have lymphatic vessels, or gateways, which are these green lines that you're seeing, and the little round nodules are the lymph nodes. How many of you have ever had a swollen lymph node? You had a flu, you had a sore throat, and you felt, and you're like, oh my gosh, that's sore, and there's a big knot there. right? That's probably the most common one that we're accustomed to having. And again, we like it when it goes down because it's no longer inflamed, right? But I have, breast cancer patients or other kinds of cancer patients. So the lymph nodes are going to be swollen in the armpits. They're going to be swollen in other parts of the body, right? And that gives us a clue. Where is the energy stuck, right? Because it's not able to make a complete pass through the lymph vessel. Spleen. In our work in energy medicine, spleen is one of the organs that we talk to in so many ways. It is critical in supporting our immune system. It is considered part of the immune system. Now, in Oriental medicine, we take the spleen and the pancreas and we treat them collectively. So if I'm looking at the spleen, I'm also putting pancreas into this. So spleen is about blood, right? But it's also about lymph. And did you know, we're going to talk about it in this class, the last point in the spleen meridian, can anyone tell me that it has a special function and what it might be? Mary, you're shaking your head. What is it? Spleen 21 is called the Great Luo and is the gateway to the entire lymphatic system. So pretty cool, right? I could literally talk to that thymus, right? Boost my T cells and my immune function, and talk to the lymphatics, the spleen 21. Let's do this. This is one of the T-taps we're going to do later, but let's do this right now. So tap your thymus. It doesn't matter which hand. And then you, whichever side you want to go first, go to spleen 21. It's about level with the breast here, and it's on the midline of the body. Tap it, massage it, whatever you'd like to do. And you can tap them both, which works the best, I think. And you want to do both sides. And you can reach over, whatever feels more comfortable. It doesn't matter how you get there, as long as you make the connection. So this is one of the T-taps. And again, if you just did this one simple exercise or shared it with your clients or friends or family, this could make such a big difference in someone's immune system. Whether they had a flu or they're trying to avoid getting a full-on flu, or they have cancer or something else that's more significant. So we also have adenoids, tonsils, a lot of controversy with that. Many people have had their tonsils removed, right, as a child. Adenoids are inflamed, tonsils are inflamed. The best thing they know to do is just take them out. Well, they're important parts of our immune function and responders. So they're inflamed because something's going on, right? The kid has 14 ear infections in a year. There's something going on, right? Versus just let's put a tube in. Let's find out what is going on. Peyer's patches. One of those things I like to say, Peyer's patches. Peyer's patches are in the wall of the small intestine. Now, the small intestine is huge, actually. It goes from here, the stomach, flows right into the small intestine, and it's wrapped around here, right here, round and round and round. And then it comes over to the ileocecal valve on your right and goes into the large intestine, right? And then the large intestine comes up, ascending colon, crosses over, transverse, comes down, the descending colon, and then exits, right? So there's a lot going on here in the small intestine before we ever get to the large intestine to eliminate. So the small intestine has these Peyer's patches on the inside wall that help regulate that inflammation response in the intestine. So when we're talking about gut health and the microbiome, it's not just about the stomach. Do you see that? Stomach, small intestine. You may have heard of SIBO, small intestinal bowel overgrowth. That's an imbalance. So we want to do things to support the small intestine. The small intestine source point's on the side of the hand, right? Small intestine 4 right here on the side. That karate chop is an easy way. Let's do that. That karate chop is an easy way to talk to the source point and go right to the organ level. Even though the organ's here, I can just do this, right? You're sitting in someone's office, you're waiting for a meeting, maybe you've got the cell phone on speakerphone and you're having a conversation with someone. Great time to do these things, right? Easy. So Peyer's patches are important, and they are part of the lymphatic system. And then the bone marrow, we talked about that regarding infants. Bone marrow, it's grown in the long bones of the body, and it's also in the brain, and it's critical to creating white blood cells to support immune function. So keeping healthy bones is important. So all of these things, we have already, even without learning new things from this class, you already have a lot of tools, right, in most of your toolboxes to support immune function. Would you agree? Yeah.
These are great for children.
Yes, they're great for children. Easy exercises, just give them one or two things to do and keep things together. Now, I put this in here to remind me, you know, we have microbes on our whole body, right? And do you know what happened over the last, maybe it was decade? When did antibacterial soap come into play? I can't remember when that was. Maybe it was the 1990s or something. I don't remember. But antibacterial soap, when that showed up, I was like so turned off from that. I couldn't go near any soap dispenser. I was like, it felt so wrong for me or foreign for me. And as I started thinking about it, antibacterial says we're trying to kill all this off, right? Well, the truth is we need some healthy microbes, right? And so the more antimicrobial products you're using, the more that started to alter the gut health and other things, right? Remember the baby in the dirt and creating that natural immunity? If we're going around and antimicrobialing everything, then we don't have a chance to really support that strong immune system. So believe me, I am a hand washer and I love my little handy wipes, but my handy wipes do not have any antibacterial soap in it. It has aloe vera in it and some other natural ingredients. So I want to support cleanliness, but I want to also support healthy immune function. Okay, so this is just to kind of give you a little bit of an idea of what's happening with the T cells. When you tap your thymus, T is for thymus, but it's also for T helper cells. So T helper cells can go out and either come out to killer T cells, which are going against the bad things, right? Or they can come out as T helper cells and going after the macrophages, which are again collecting and eating bad things. T helper cells can also go up and through generating B cells for bacteria, now I can make antibodies. And antibodies allow me to have a healthy immune system. Again, just tap thymus all day, right? I could have taught a lot shorter class. All right, immune function. This is it. Listen up. Tap your thymus, okay? It really is important. So this also just shows you first exposure to something, an initial response, protective immune system. As weeks and years go by, what happens to those T cells? We've got an apparent reinfection, a mild or some type of infection. So this is what happens. If the immune system is off, our T cells aren't functioning properly to go do what they need to do. How many of you have ever had a flu and you thought, oh, finally I got rid of it? And then guess what? You had it again right away. And maybe you went through 2 or 3 rounds of it. Yes, some of you are raising your hands or nodding your head. That is because we didn't get the immune system strong enough to begin with, and so it's like lingered, right? So B cells, B cell receptors, immunoglobulin antibodies, and there are a bunch of them. They're all IG and a letter. And again, this is in your handout, but here's why I want you to know this, because IgA it creates antibodies for mucosal linings. Everything inside us has a mucosal lining pretty much, right? We have mucosal linings in our eyes. It's also in the gut, saliva, tears, respiratory tract, urogenital tract, breast milk. So this is a healthy antibody, IgA. If it's strong and healthy, then we're warding off again the invaders. It prevents pathogenic colonization. IgD, It's an antigen receptor on B cells. It activates basophils and mast cells to produce antimicrobial factors. So this is our natural immune system saying, let's create our own internal force to go out and be antimicrobial, right? Not the funky soap at the department store. IgE is responsible for allergic response. It triggers histamine release from mast cells and basophils. So this is the classic person that comes into you that has asthma, that has allergies, those kinds of things going on. It might even be seasonal allergies. So look at, is it in the springtime? Is it in the fall? You know, what's the allergen to? So you can do the advanced substance testing and help to reset and reestablish the substance and to reduce the response, right? But it's also protecting us against parasites. So depending on what's going on in gut health, we need all the gamma globulins to be on board because, you know, we don't want parasites to say, hey, this is a nice, cool place for me to hang out and take control. Let's see what else we have. IgG. IgG is the most common antibody, and you might have heard it if you've dealt with or had anyone that's gone through an immune issue or Lyme disease or other kind of chronic immune issue. Majority of the antibodies are based on immunity against invading pathogens, and that's what IgG is going to do. It crosses the placenta to give passive immunity to the fetus. So this is the first one that we got, and it's also the strongest one, and there's like 4 types to it. IgM eliminates pathogens in immature B cells. It may impede disease process. It activates the macrophages, and it destroys the foreign substances. And this is just a cute picture of lymph nodes that I like. Isn't that a great one? So the green stream is the lymph vessel, you know, and the little blue dots are the lymph nodes, the nodules. So you can move along the pathway, you can exercise to move the lymph, but remember the reflexes that we use, the neurolymphatic reflexes, are associated with the organ and less about moving along the lymphatic lines like a manual lymphatic drainage massage.